A lot of my customers have asked me to do a troubleshooting video for the VQ Propel and Propel OA knee brace. So here goes. Biggest issue I see in bracing, and anybody sees in bracing, is slippage of the brace. So if a patient comes back to me and says the brace is sliding, I look at 4 different things. I look at proper application, I look at strap length, I look at number 1 strap being up high enough, and the 4th is the anatomy of the patient. So as far as application goes, when we fit a brace, a lot of these patients, it's overwhelming. We give them a lot of information. So they miss one step, it can affect the whole outcome of the brace. So I always get the patient, when they come back in, say the brace is slipping, get them to put it on in front of me. That's the first step. Second step is look at the strap length. The straps on the back need to be adjusted to proper length. Now, if they're too long, the brace will actually slide. So when you look at the brace, and especially number 1 strap is the most important strap. If you see the Velcro tip over the edge, that means the strap is too long. So easiest way of adjusting it, and it's really very simple to adjust. Open up the strap, take off the strap pad cover. You can just shorten the strap, or if necessary, you can cut the strap, reapply the strap pad, feed it through. Rule of thumb is the strap should be at least 1 to 2 finger widths from the edge. Especially number 1 strap, that's the most important strap. Third thing to look at is that this number 1 strap is up high enough. Majority of the cases when people apply the brace, they put the brace on too low. Okay, that's the norm. So what I do when I actually talk to a patient or fit a patient is I get them to put the brace on, of course. And what I do with number 1 strap is I want the strap to be as high as possible. This is the anchor. This strap is the most important strap. So I feed it through the ring, and as I feed it through, what I do is I pull the brace up. I keep the brace in the proper position, but I pull it up so the strap is sitting above the calf muscle, just below the bend of the leg. Now, why I do that is that the higher the better. Then I know it's going to drop into position. As soon as I take the first few steps, the brace will drop. As long as the strap is above the calf, it will anchor it. So if it's not, if it's sitting partially on the calf, when they take the first few steps, the brace will slide down. So make sure that the strap is up as high as possible. Err on too high than not high enough. Now, the third thing I look at is the anatomy of the patient. If all the other things you've done are right and you still have slippage, it could come down to the actual leg. So you have patients that have no calf muscle. You have patients that have no muscle tone at all. You have patients that have a bigger thigh, smaller calf, or no calf. Sometimes it's very difficult to suspend a brace on. What I do then is I jump to my best option is I add a number 6 strap. Now, number 6 strap, basically what it is, it's an anterior strap across the thigh. So now when this is applied, when the patient goes to get up, that strap will drop and anchor above the condyles. So it's an additional suspension strap. This strap works great. Majority of the cases I have slippage issues, this solves the issue. So the next troubleshooting I look at is the patient comes in and they have shin pain. There's 5 things I look at. First of all, make sure they put the brace on. Proper application is a big thing. They can be putting the hinges too far interior. They may not loosen number 5 strap. The tibia groove on the liner is not lined up with the tibia properly. If those don't happen, then we can look at maybe there's too much correction in the brace, or the active thigh is too short. So first thing is proper application. Patients, again, are overwhelmed when they get fitted with a brace, so they tend to put the brace sitting too anterior at the knee. You have to make sure the brace sits back as far as possible. Easiest way I do it is that when I put it on a patient's leg, the condyle pads at the knee, I want them to sit back as far as possible on the leg, okay? How do I do that? How do I know if they're back far enough? If I can't see underneath the condyle pad, the brace is sitting back far enough. If I can see underneath the condyle pad, that means it's sitting too anterior. So what happens is with the hinges sitting too anterior this way, this cuff is now angled into the shin and they're going to get shin pain. So by bringing the brace back properly, we'll bring the cuff more flush against the shin. Okay. Second thing is, if they do not loosen number 5 strap. A lot of patients will not loosen the front strap when they take the brace off. It's very important for that to happen, because if this number 5 strap is too tight, what happens then is the hinges will shift anterior. So we're in the same effect if they don't apply it properly, that now the tibia cuff is going to dig into the shin. So always make sure they take off the front strap. And you'll notice that when you have them put the brace on, if they're doing that or not. Okay. Third thing is the tibia groove. Now, the tibia groove on the liner is designed to line up with the tibia crest. If it doesn't line up properly, when the patient gets up to weight bear, if that groove isn't sitting in the proper position, they're going to get shin pressure. So what I do is I put the brace on, have the patient get up, walk around, check to see if that is lined up properly. If it isn't, what you need to do is sit them back down, take the brace off, move the liner to the position where it's now going to have the tibia crest in the proper position. So remember, do that when they're weight bearing. The thing is, when you're sitting versus when you're standing, a lot of these patients have a lot more rotation in their knee. Check it when they're standing versus when they're sitting. If it lines up, that will take a lot of pressure off, okay? If those three things don't solve it, then what you can do is now, when you apply the brace, patient applies the brace, tighten the fifth strap when the brace is on. Now, the fifth strap, when you tighten it, will help pull the cuff away from the shin a bit. You don't want to pull it too much because that'll affect the function of the brace, but pulling a little bit will help relieve pressure on the shin as well, too. The other thing can happen is that the active thigh may be too tight on the thigh. Now, what happens is if you see the active thigh and it's tight at the bottom, but there's gapping on the top, that means it's too tight. And what will happen is the brace will tend to want to position itself so these become flat, and then the hinges shift too far forward. Same thing again. If they shift too far forward, it's going to cause shin pressure. So what you need to do is you need to open up the active thigh. So how you do it? The two straps are adjusted at the bottom. You take the liner off inside. You have your Allen key. Take the screw out, move it over one notch. Open it up one notch, and that's on both sides. That should be enough. When you reapply it, you'll see that the active thigh is sitting flush and that you won't have any shin pain from that. Now, the last thing is, if the patient is still getting shin pain, it could come down that there's just too much correction built into the brace. This is somewhere you definitely want to go back. If you are a patient doing this, go back to the fitter and have them adjust it. But when we put correction into a brace, it's a 3-point leverage. So when they put weight down, there's a force going here, here, and here. So if there is too much correction, that force here will cause pressure on the shin, especially from the medial side of the shin. So what can happen is we can take off correction. 1 degree turn, Allen key takes off correction. They can do it weight bearing, and they'll take some pressure off the shin as well. Like I said though, if this is a patient, do not adjust this. Go back to your fitter, have them adjust it properly. Even the active thigh adjustment, I would recommend to go back to the fitter, have them adjust it. All the other situations you can adjust on your own. I want to go over fitting of the brace, the Catalyst Propel and Propel Away knee brace. I want to make it easier for the patient and for the fitter on how to apply the brace properly. So the two most important things I look at is where number 1 strap is positioned on the calf and where the hinges are positioned at the knee. Now, positioning at the knee. Again, always make sure the brace is sitting as posterior as possible. Easier way of doing this. If I cannot see underneath the pad at the knee, that means the hinges are sitting back in the proper position. If I can see underneath the pad at the knee, that means the brace is sitting too far forward. You're going to get shin pain. The brace isn't going to function properly. So make sure that the hinges are sitting back as far as possible. Now, number 1 strap. Number 1 strap is the anchor strap. Okay, it's the most important. If it's not in the right place, the brace will tend to slide. Easiest way of doing this, and this is different from what our instructions are in the pamphlet. I want that number 1 strap to be up as high as possible. Air on too high, the calf muscle. When I feed the strap through, I bend the D-ring and I slide it in. Now what I'm going to do is I'm going to pull the brace up, and I'm going to pull it up, make sure it's in the right position, and I'm going to go as high as I can till I can't go any higher. Then I know that the brace is sitting high enough on the calf muscle. From there, I'm just going to snug the brace, okay? You do not ever want to over tighten the straps on a brace. So now when I get up to walk and the muscles drop, gravity, the muscles will drop, the brace will drop and anchor on top of the calf muscle, eliminating chances of slippage. Okay. From there, you're going to follow the order of application. So number 1 was the top of the calf muscle. We're going to go number 2 at the bottom, number 3, number 4, and number 5 being the last. So now you just want to snug it up. Rule of thumb and tightness of straps. The theory, the tighter the more support, is a really bad theory. You do not want to restrict the muscles from moving. That can fatigue the muscles, it can cause muscle atrophy. You just want it snug. And I'm going to show you when I stand up how tight they should be. Okay, so we're going to go to number 3 next. Going up the leg. And number 4. Okay, So the back is in position. Now, number 5 strap. Same thing, you do not want to over tighten it. What you want to do is you want to just pull it that you get a little resistance. If you pull it too tight, the hinges will shift to anterior. So just a little bit of resistance. So what I get is I get my patients to stand up, okay? They're going to feel the brace drop. That's normal. It's dropping in position. So take a few steps, walk around, let the brace drop into position. Once it drops into position, readjust the tightness of the straps while they're standing. Okay, the muscles are in the position where they should be when the brace is doing what it's supposed to be doing. So all I want is down the middle of the strap is that I can get the tip of my finger in there. Why that is, when you do activities, anything, exercise, just walking, your muscles expand. You have to give room for it to expand. So by a finger tightness, that will allow the muscles to expand properly. So any adjustments, always adjust the back straps first. So I always adjust number 4, number 3, and number 2. Never touch number 1. It's anchored. If you were to loosen it now, the brace would slide down. So you leave that tight, okay? Readjust the tightness. Once the back has been readjusted, then you're just going to tighten the front strap. And again, just a little resistance. See how the brace moves a bit? That's as tight as you want. Now it's ready to go.